we're pleased to have Elizabeth Frankenberg moderate this session. She's from University of North Carolina and a member of the committee. Elizabeth?
Thanks. Well, we had a really interesting pre-workshop call, so I think this will be a great session, and I think I'm going to follow Rich's practice and get our panelists to introduce themselves, because they each have a very interesting perspective on the topic we'll be talking about. So let me turn to Dr. Schwartz.
Thank you. Good morning. I'm Stephen Schwartz. I am the director of the Division of Vital Statistics at the National Center for Health Statistics at CDC. And I've been there just 1 year now. Prior to that, I was the registrar in New York City for over 20 years. And when people ask me what I did for a living, I learned that I should not say I was in vital statistics because they mostly fell asleep before I finished the sentence. So instead, I would say I was responsible for life and death in New York City.
Thank you. Sorry, Dr. Shaw?
Good morning. I'm not sure I can top what Dr. Schwartz just said, so I'm trying to think in my mind, is there anything I can say about life and death that would be helpful? But good morning. My name is Umair Shah. I'm the Executive Director at Harris County Public Health, and I really want to thank the committee for inviting me. I see a lot of colleagues and friends from yesteryear, but also currently who are a part of this committee, so it's great to be here. I'm the Executive Director of Harris County Public Health, which is the county health department in Houston, Texas. Our county is the third largest county in the U.S., third most populous, I should say, 4.7 million people, which would rank us between Kentucky and Oregon as number 26 or 27 as a state, and we're geographically spread over 1,800 square miles, which ranks us just above Rhode Island. And we have been through a number of different emergencies, and I'll be happy to share those. I also am an ED physician at the VA Medical Center in Houston as well, and I think there's some perspectives that may be coming from there as well. But it's great to be here this morning.
Good morning. Good morning. I'm Skip Skivington from Kaiser Permanente at our national headquarters out in beautiful Oakland, California. And when Elizabeth said that we had a lively meeting, prep meeting, I actually thought I was going to get voted off the panel because of trying to get my head around this whole issue. I mean, I can understand it from an academic point of view, but I was coming at it from an operator's point of view and trying to channel the Kaiser Permanente experience and how we respond during disasters. And I'll talk more about that. And I really compliment the Academy for addressing this issue, because now I get it. After the first panel yesterday, I can see why that tension existed in my head and why it exists today. And but the good news is I think there's some things we can do about that. So glad to be here.
Good morning. I'm Kevin Yeske. I'm the Principal Deputy in the Office of the Assistant Secretary for Preparedness and Response at the Department of Health and Human Services. And we have the portfolio of managing and coordinating all the federal health assets for preparedness, response, and recovery within the federal system. That includes our hospital preparedness program, our national disaster medical system, things like the Medical Reserve Corps, but we also have the Biomedical Advanced Research and Development Authority that helps bring medical countermeasures from clinical research and development all the way through licensure and inclusion in the Strategic National Stockpile, which we also have as part of the transition over the past year.
Great. Thank you very much.